we have currently in society is very simplistic understandings of what obesity is, and we don't really disseminate the information and evidence that shows the complexity of obesity. So we know that people of all ages and all backgrounds are reporting stigmatizing attitudes, and this starts from a very early age. We know that people are stigmatized in settings including workplaces, so people are stigmatized by fellow employees, by management, overlooked for promotion, also in the recruitment phase. The stigma is a major challenge in healthcare. We actually know that there are many people experiencing stigma almost daily, and the healthcare setting is one of the most prominent settings where these experiences occur. In addition to poor communication from healthcare professionals to patients, we also know that patients don't always receive the options that should be available to them. So for instance, we know that people aren't always offered referral pathways to different types of services, and maybe even treatment where relevant. What we should also note is that stigma is very evident in policies themselves, so the way that policies are written in terms of the narrative around obesity can actually be very stigmatizing itself. For instance, if you reviewed a policy relating to cancer, it tends to be quite positive, and we want it to be positive because we want to give people hope and optimism, and we also want people to know that they are supported. However, if you compared that to policies relating to obesity, it's often very negative, pessimistic, and in many instances, it increases people's fear and anxiety around obesity. So improving policy is one of the key steps that we can take in terms of improving the landscape relating to obesity, and it's certainly one of the best ways for us to set the agenda relating to obesity. Recognising obesity as a disease is one mechanism that might improve the landscape of obesity. What we do know is that if obesity was recognised as a disease, that would change the face of healthcare, because it would mean that patients in healthcare settings would need to receive the right types of support from healthcare professionals, which currently are being overlooked.